How are you, Suzanne?
Good, how are you?
Very good. How can we help you?
I would like to come in and take a look at doing something with my droopy breasts.
Mm-hmm. Okay. Well, there are several ways of fixing droopy breasts. One of them is a mastopexy,
Okay.
which involves creating scarring on the breast. Now, if you don't want to have scars on the breast, we also can fix your breast by doing what's called a transumbilical breast enlargement.
Okay.
Okay, of course that can be used for people that don't have droopy breasts, but also it's also very helpful for people with droopy breasts. Okay, and I'll explain to you how we do that. There's no new scar created on your body with this operation. One natural scar, and that's your belly button. We make an incision all the way down in the bottom of the belly button. Now, when that heals, there is a scar, but it's a scar on a scar, and it's basically imperceptible. We tunnel underneath your skin, not inside the abdomen where the organs are, but just underneath the skin surface. Now, at this point, when we get up near the breast, we can go into two positions. We can go either under the muscle, which we would do in someone that had very little breast tissue,
Right.
or we could go above the muscle and under the breast tissue in someone like you that has droop.
Okay.
If you have droop and you go under the muscle, you'll still have droop. So the best place for it is under the muscle. Now, after we create this tunnel that's about the size of my finger, we use a special tubular device. After we create this tunnel, we then look in that space with a television camera. It's a long, thin television camera that that's attached to a monitor. So we can tell exactly where we are, what plane we're in, and we know where we're going to put the implant.
Okay.
We then take an implant like this that has a long tube attached to it. Now, this tube goes through a special self-sealing valve and goes into the implant. And you can see that the tube is extended into the implant, and at the end of this tube there's a little wedge itself into the valve and seal it as we pull this tube out. So what we do is we take all the air out of the implant by squeezing it like that. And then we roll the implant up so that it's the size of a cigar. Sort of like this. Now it's nice and skinny. Okay, we slide the implant up the tunnel that we've made until it sits where we want it, in your case underneath the breast tissue.
Okay.
We then let this end of the tube stick out the belly button. Now we inflate the implant with saline solution, sterile saline solution. Now many people ask, can bacteria grow in that solution? And they really can't with the techniques that we use, because we use a completely sealed system.
Okay.
We go from a sterile intravenous bag into a sterile tubing, into this tubing, so the saline never is exposed to the air. Consequently, there's no chance of it becoming contaminated.
Right.
Okay, we inflate the implant to the size that we really want it to be. Okay? We then pull this tube, and as we pull it out, it pulls that little plug into the valve, it wedges itself, and then the tube snaps off, and the valve seals. And the valves are very, very secure. They rarely leak. They can. They're all man-made things. But they usually don't leak. Okay? After we've filled this to the proper size, we pull the tube out, and we do the other side, and the whole operation is over in about 20 minutes. Now, the advantage is that there's very, very little bleeding. We don't cut any tissue. We don't burn any tissue. So consequently, scarring is much less with this operation than the other techniques. Recovery is much faster. Now, you're from another state, so that we're going to do you tomorrow. The day after the surgery, you'll be able to go home. And you'll feel well enough to travel. You'll be a little sore the first night, but you'll feel well enough to travel. And you'll go back home in 48 hours after you've come here with new breasts. That's the rapidity at which you can get back to normal activities.
So there's no restrictions on weight or anything like that as far as
With this technique, there's basically no restrictions after the first 24 hours.
Okay.
You can do pretty much anything you want.
So I can pick up my 60-pound son and be okay with
Yes, you'll be fine. Now, if you were under the muscle, I would say you should wait a day or two before you did that.
that? Okay.
But since you're under the breast tissue, the healing is much quicker under the breast tissue. In fact, your breasts will look normal within 48 hours after surgery. They'll be a little swollen, but they'll look normal. You could literally go to the beach
That would be
48 hours after surgery. Under the muscle, it's a little bit different. It takes a little bit longer before the breasts look normal, and you have to limit your activities because we're dealing with your own muscle. But with this technique, you'll find that your recovery will be very quick.
good.
Okay?
I like that.
Now, we're going to take you into the to the examining room. We're going to examine you. And then we're going to take you into our computer imaging room where we're going to take some digital pictures of you.
Okay.
Okay? And then what we will do is we will show you on our imaging screen your before, and we'll change the image so that we can show you an approximation of what you'll look afterwards.
Great.
Okay? And the way we operate is we ask you to bring a picture, or we'll create a picture for you. And then we make your breast look like that picture. Now, remember, we take your breasts and we make them bigger. So if your nipples are pointing to the side, they're always going to point to the side. If your breasts are conical in shape, they'll always be conical in shape, but they'll be bigger. So we use that to determine size, not so much shape. If you have an asymmetry to your breasts, we can usually make some corrections in that, but the two sides never come identical, and a woman's breasts are never identical in size or shape.
Okay.
Okay, so I'll ask my assistant to take you into the other room and we'll examine you. Okay?